Hi, my name is Anna Glithero, and I'm going to be presenting my complex problem. So my complex problem for this course has been providing aid to immigrants entering the U.S. Alrighty, so to just go into a little more depth, my complex problem involves providing aid, and this concerns housing, legal aid, healthcare, education, and so forth. My goal with this presentation is to examine these issues and to provide actual tangible forms of support so that you as the viewer can kind of take these into account as you move forward. And if this is an issue that concerns you or that you're interested in, these will be ways that you can actually make an impact. So I kind of just want to talk about this in ways to help them obtain what they need to live safely and feel like they're supported here in the U.S. Alrighty, so this is just kind of a background on restrictions. I'm going to be sharing a little bit of information from an article from the National Immigration Law Center because they actually had an article specifically on eligibility restrictions. These restrictions are kind of the backbone of this complex problem. Without legal action, I feel that not much can really be achieved beyond nonprofit work and legal coalition efforts. So the website shares a section titled Categories of Immigrants, Qualified and Not Qualified. And this lists the qualified eligibility according to the welfare law, which categorizes the two groups of people. I'm very briefly just going to be touching on what makes them qualified, because when we think about not qualified, I feel like that's kind of better understood than what qualified means. Not qualified would just be based on, if they're not legal citizens, if they don't have approved documentation status, that would kind of qualify as not qualified. So for being qualified, this consists of lawful permanent residents, or we can call these LPRs, people who have green cards, people who have been granted asylum or are withholding of deportation, or removal and conditional entrance. People granted parole by the U.S. Department of Homeland Security, or DHS, for a period of at least 1 year are qualified. Specifically, Cuban and Haitian entrants are qualified. And certain abused immigrants, abused children, survivors of trafficking, individuals residing in the U.S. pursuant to what's called Compact of Fee Association, and this is associated with Medicaid. So, as for statistics, let me just move this over here. I'm going to be showing you a little infographic to the side here. This kind of shows the healthcare barriers that are faced by immigrants both entering the U.S. and currently living in the country. So this little pie chart here, we can see there are nearly 45 million immigrants in the U.S. and 1 in 4 children has an immigrant parent. So that's a pretty big number. That's why this is such a big issue. We can see here that 7% are naturalized citizens out of this chart here. 7% are non-citizens. And we can look here, citizen children with naturalized citizen parent is at 10%, and so forth. So you can kind of just take a minute to look at this chart. I found it very useful in just kind of helping you visualize the actual numbers, because they are so big. And this is looking, remember, this is the amount of immigrants who are facing these issues. And we can also see that non-citizen immigrants, so legal immigrants, are more likely than legal immigrants to be uninsured and face barriers in obtaining health coverage, health insurance, Medicaid. all under that umbrella. All right, so continuing to talk about healthcare and health effects, I'm going to be sharing some information from an article that I read by Allison McCord Stafford and several other authors. They are of the Journal of Racial and Ethnic Health Disparities, so this is very niche for them. This is a very specific conversation. The article examines how immigration-related stress and healthcare-related stress are actually caused and coincide. And they talk about whether or not these stressors can relate to documentation status and physical health. This article also touches on immigrants residing in North Carolina here in the U.S., so this kind of brings it home a little bit. And I'm just going to kind of read a little excerpt from the article so that I can give you like the full background. The purpose of this study was to determine if immigration-related stress and healthcare-related stress can explain that documentation status and health kind of concern relationship. They used a conceptual model, which you can actually see right here. I took a little screen capture just to kind of show you if you're a numbers or statistics person. I am not, so this is not as clear to me as just reading the article, but if you'd like to look at it, it's right there for you. So they actually use this model to test this hypothesis, this theory, utilizing baseline data from community engaged research. And they did this with young adults from 18 to 44 years of age. So it's a pretty broad study. I'm not going to go too into depth about everything that went into it. It was a very big article, a very intense study. But this is kind of just an insight into these health effects, that they actually had to conduct a study because people are so intensely impacted by the immigration process physically. Alrighty, so we're going to talk about legal aid for a second here because it's kind of the bigger piece of the puzzle, I think. So I want to mention that I think pro bono legal services are kind of the most helpful. They provide representation to low-income immigrants. Aid with obtaining green cards is a big thing as well, because that is actually going to grant you your citizenship. So this is a screenshot of the CRIS website. Now, CRIS is the Community Refugee and Immigration Services location for Central Ohio. So this is another way to kind of bring it home. Their mission is to help refugees and immigrants reach safety and stability and sustain self-sufficiency, which is also a really big deal. They're an independent nonprofit, and they actually have the ability to directly receive and place refugees and immigrants of our community. So they have a lot of power to do good, and they do good. They do a lot of good work. They have a lot of services, as you can see in this picture here, which is just really kind of a beautiful thing. And they have ways to get involved, resources, and they even have a news tab, so you can kind of stay up to date with all the things that are going on, which is important because it's a lot of things that are going on, and it's hard to keep up with all of it. So we're going to talk about education. This is an image from the National Immigration Forum, just kind of showing access to higher education. So there are educational barriers faced by students of all ages who are immigrants, especially children. A large part of this puzzle surrounds children, how they grow up within their families, if they're immigrants themselves, and kind of what their perceptions of themselves are while they're in educational settings. It's important for children to be part of a foundational and beneficial learning experience, no matter where they come from. And one of the ways that we can actually support immigrant children in the U.S. is using DACA, which I'm going to segue into. So what is DACA? You've probably seen it, you've probably heard the word, the acronym, but you don't really know what it is. So DACA stands for the Deferred Action for Childhood Arrivals. It's a program. It protects eligible young adults who were brought to the U.S. as children from deportation. So I'm going to show you this little infographic really quickly. This is from the Mayor's Office of Immigrant Affairs in New York City. So this is kind of just what to know, what to consider with DACA. The current status of the DACA program says that individuals who currently have DACA will be able to continue renewing for now. Folks who currently do not have DACA can still apply. They have that opportunity. The federal government will accept the application. And advanced parole will remain open to current DACA residents. So this is a good thing, but it is also important. And this involves children. This involves ensuring that children have that eligibility in this country and that they can do what they need to do to receive education. I'm going to talk about the effects of immigration very quickly, which I think we've kind of covered pretty decently. So we've gone over the mental and psychological effects, the physical and health effects, and the emotional. It's just kind of, I think, understood that a lot of immigrants who are facing these challenges are having, they're facing a little more than some of us are, and they have a few more hurdles to jump. So yeah, I just kind of wanted to bring it back a little bit. So, realistic approaches to solutions, which is kind of what I'm getting at. So the issue is complex for a reason. There are many facets and provisions that are involved, and so much of the issue is legal. Pinning down one major solution is unrealistic. But I did some research and found an article by, I don't want to butcher the name, this name here, titled Practical Solutions to Assist Cities and States Receiving Asylum Seekers Across the U.S. So I'm just going to read about this. She shares that this report provides examples of initiatives from, as I said, cities and states with recently arrived immigrants, and underscores how other jurisdictions that receive migrants can use these as models. So she offers 4 recommendations to better address the needs of migrants and the jurisdictions supporting them. So I'm going to talk about that. Increasing coordination between the federal government and local jurisdictions. Boosting federal funding and resources to assist receiving jurisdictions in meeting the needs of the immigrants. Expediting work authorization at the federal level, and addressing the root causes of migration to ultimately help curb the flow of migrants arriving at the border. This is just a quick little infographic of a social worker perspective, which I find very important. So this says how social workers support immigrants, provide mental health resources, advocate, foster job development, inform them about their rights, and guide immigrants to resources for food, healthcare, and housing, which is all kind of wrapped up into what we've talked about in this presentation. Yeah, so that is the end of my presentation. I do want to say that obviously this issue is controversial. There are parts of it that people agree and disagree with, but it is an issue, and that is what makes it my complex problem. All of the different facets and all of the ways to approach the problem make it easy to present about. But yeah, so that is all of my information. So thank you for watching.